Okay, so this is, we presented this last week, and this just shows the heat map of cases, and then July 26th, just how the country, you know, from July 1 to July 26th turned pretty red, and as of August the 1st, even redder. And I put these slides together on Sunday, so I'm sure it's even redder as far as high transmission rates. This is the CDC graph showing, let me get a laser pointer here. CDC graph showing, once again, this very precipitous upswing in cases. They mention here that the 7-day rolling average is up almost 34% over the past week. In Washington State, we noticed this last time. When we reported this curve here, the case rate was 130 cases per 100,000. And this graphic here shows 210, but as of August the 5th, the number was 268. And so today it's probably even higher, because that's 4 or 5 days more. And so just from 130 to 210, there was a 62% increase. Using the 268 case rate, there was a 106% increase from last time we spoke about this. So, and also the data does lag by about a week or so. So this is, and then we've been looking at some of the surrounding counties, and also looking at French County, but this is Benton County. Also, one thing I want to have you guys focus on is just the peak in the case rate. I'm going to back up one slide. So statewide, the peak case rate is somewhere around 500. And this is before vaccine. Remember, we started our vaccine program here like January 18, and for a couple of weeks before that, we were getting healthcare providers, but there's really no vaccine in the community for the public. So most of these spikes occurred before vaccine rollout. And so Benton County, their spike is much higher than that, 400, 500 state average, probably 700-ish. Benton County, as of August the 5th, their case rate is 740, so a pretty dramatic increase. Franklin County, their case rate peak is even higher than that, maybe 1,200. And as of August the 5th, their case rate is 853. So they've gone up significantly as well. And then we've been looking at King County. I'm just trying to look around the state, and when we last reported, they were 98. This graphic shows 159, but as of August the 5th, they were 206. So pretty dramatic increase as well. Also note the peak, King County, less than 500 cases per 100,000. And this is the Walla Walla County graphic, and our number here is 468, but as of August the 5th, we were at 511, and we might be a little bit higher than that, but we've been talking about this, we've had this prolonged progressive increase in our case rate, and our case rate has been relatively sluggish with uptick. Over the past week or so, we have had an increase in our case rate, but in general, we just don't have the same precipitous incline that other counties have had. Also, looking at the case rate, the peak case rate, I mean, this is somewhere around 1,200, 1,300. So I don't know if that's how to really account for that, but maybe even the curves here, but at least we're somewhere around 1,000 for case rate. And then looking across the state, this is since the pandemic started, case rate per 100,000. This is the Cascade range. You can see that there's a definite disparity between east side and west side with case rate. And in some cases, some counties are several times higher than in the east side than on the west side. So it's a significant disparity, and obviously Eastern Washington is much harder hit by the pandemic than the west side. This is as of Sunday, which again, the data lags a little bit, but we were #1 in the case rate, and now we've dropped down to number 4. But, you know, counties like Columbia have such a small population, it only takes a few cases to bump their 100,000 case rate. Nevertheless, you know, we've been looking at these curves, and so many counties have had a higher case rate. So I'm anticipating that other counties will continue to leapfrog us. And once again, we continue to test more per capita than any other county. King County actually had a pretty big jump up. This is a 14-day rolling average. So these numbers do bounce around, but consistently, since I started looking at this in June, we've consistently been a leader in the state for testing. Oh boy, sorry about this slide. Anyhow, this part of the slide right here is asking the question, how long is this current surge going to last? And I'll show you the graphic in a minute, but we've had 4 surges in Walla Walla and in the state since April 2020, and so we're in the 5th surge. And looking at all of these surges, the shortest little wave or surge lasted about 2 months. But on average, it lasts around 4 to 6 months. The longest surge we had lasted 7 months. And the time it takes to get to the peak takes somewhere between 6 and 10 weeks. Keeping in mind that our curve is a little unique. It's different than any other areas in the state. But once you reach peak, the peak lasts for about 1 to 3 weeks, and then it starts to decline. This is a kind of a blurry slide because I had to expand it, but basically the forecasters from CDC and elsewhere, there are different models. Different models make different assumptions, but most models suggest that our case rates are supposed to flatten. Back to this, this is the statewide case rate curve, and you can see there's 1, 2, 3, 4 peaks, the 4 waves, and now we're on the 5th. Likewise in Walla Walla, 1, 2, 3, 4. So this must be the 5th. Also note that statewide we never really got back to baseline. Walla Walla was a little better, getting a little closer back to baseline after these little surges. And then we keep mentioning how we just have this different shaped curve. So if we use May the 8th as a starting point, because I think this wave right here is this wave right here. And so somewhere around May the 8th, looking at the average, or looking at the longest duration wave that we've had, we're probably near the top. And so, again, I don't have a crystal ball, and Delta variant is kind of unique, but if this pattern holds, we're probably somewhere near the peak, and so I expect cases probably to remain high in August, and then start to decline, and hopefully we will return to baseline somewhere in October or November. And it also appears that looking at other counties, that potentially the rest of the state may lag behind about 4 to 6 weeks. It seems like we started this process about 4 to 6 weeks earlier than the rest of the state, and so I think they will lag a little bit. So, you know, we've been talking a lot about our best way out of this predicament, and certainly vaccines are the best way out of this predicament. I'm not sure what that slide is. I also want to remind people that you know, the CDC and Governor Inslee and many of the local health jurisdictions are recommending that people mask indoors because the Delta variant is so much more infective. Last week we talked about some of the CDC information that led to that decision. And so, but I think the main thing we can do is just get people vaccinated. We did start our vaccination blitz yesterday. Yesterday they had food truck night, and we had people there. Today there's an event at the Prescott Pool. We also have events every day this week. We've extended the hours at Providence Southgate Clinic. And we also have events at the community college and at the Hapo Credit Union. And we're going to try to continue for the next several weeks just to really push it hard. I'm hoping demand will be there, so just encouraging people to talk to their family and friends and see if we can encourage people to get vaccinated.